Welcome to the weekly series of Healthcare Scene Google Plus Hangouts, where we sit down with the various leaders of healthcare IT and discuss the trending topics. So before we begin, I want to remind those watching live, you can tweet any questions you have to the account at EHR and HIT. We'll try to keep an eye on it. And this one, we kind of twisted it up a little. Instead of me interviewing someone else in healthcare IT, I decided to bring in Ann Zeiger, who writes on EMR and HIPAA. In fact, she writes on all of our sites, EMR and EHR and hospital EMR and EHR. And I'm live at CHIME, so excuse the new background. But yeah, welcome, Ann, and glad to have you here, and look forward to discussing what I found here at CHIME.
Thank you, John. I am eager to hear what you learned as well. So how has the show gone? Has it been well attended?
Yeah, so last I heard there were 750 attendees for the conference, which is pretty good. I mean, every session's been full, the hallways are packed, and it's really interesting at CHIME because at CHIME it's really an intimate setting. They always do some sort of resort area, and so the resort is almost overcome by hospital CIOs. So everywhere you turn as you walk through the halls, you're running into them. So it'll be interesting to see if it continues to grow, if it can continue to maintain that intimacy where, you know, in the elevator, sitting at a table, grabbing a drink, you know, you're meeting someone that's a hospital CIO or at least related to CHIME. So yeah, I think it's been really successful.
And who showed up? Were there only hospital administrators? Did any, say, large group practice members show up? Or is it exclusively a hospital thing?
Yeah, it was interesting. I was sitting down, I think, for breakfast yesterday, and this lady sat down next to me. I guess she runs a rec now, but she was like, yeah, I was the first ambulatory CIO that they let in. So I guess there are some, but, you know, it's definitely dominated by the hospital side.
Okay. Well, one of the questions I think we're all curious about is, what was the buzz about which EMRs are on top? Because as our sites have published, there's been, looks like a going battle between Epic and Cerner that didn't exist before, at least in certain spaces. Did you hear anything about EMRs that surprised you? What was the status there?
No, I don't think it was that surprising. I mean, everyone pretty much said that Epic and Cerner are dominating, especially the large hospital space. There was one interesting meeting I had with someone where they said that some organizations just can't afford Epic or Cerner, so they just have no choice but to be something else. So we'll see what that means for the smaller hospitals. But definitely when it comes to the larger hospitals, I mean, all the discussions are Epic and Cerner. And I think that there's more larger hospitals represented here, although, you know, it'd be interesting to dig into that data with CHIME to know if that's really the case. But yeah, it's definitely Epic and Cerner. Although the other thing I think worth noting is that it's amazing how many other services a hospital uses. So they may be on Epic and Cerner, but they may still be buying stuff from McKesson and from some of those other, you know, competitor EHRs that offer other services. So I mean, you know, while Epic and Cerner dominate the EHR landscape, the hospitals still have relationships with all those other EHR vendors as well.
Are you referring partly to the need to support ambulatory care when they buy practices?
Yeah, sure. In some cases, those. Although the trend there still is really, there was a hospital system I interviewed for a number of years back, and I ran into them, and they were on. Maybe I'll just avoid names for that, but they were leaving that other ambulatory practice and going with Epic, and I think that's really the trend for most of those hospital systems that are on Epic and Cerner, is really moving their ambulatory to one system, and I'll be surprised if that changes.
Okay. I'm sure there was a lot of talk about meaningful use. To put it lightly, is there anything you heard about meaningful use that surprised you or was new? What were some of the trends coming up in terms of people's readiness and availability to get the incentives?
You know, interestingly, I mean, certainly meaningful use comes up in every conversation you have, but it's no longer about what are you doing with meaningful use. It's just kind of meaningful use is an integrated part of everything we do, as opposed to actually being like, oh, are we going to do it or do we not, or how do we do it, you know? So it's really just kind of an overtone as opposed to the core of the discussion. You discuss something else, and then of course meaningful use impacts it in some way. So I guess that, you know, maybe it's just a feature now as opposed to the core of what they're doing.
Do you think that the vendors are up to that, having it be a feature rather than something that has to be integrated tactically?
Um, well, I mean, I think stage two is going to be interesting, right? There's certainly plenty of trepidation about trying to be ready for it. So I think the jury is still out on that. We'll see after meaningful use stage two, and we'll see what comes in stage three, which that's what they're all looking for. It's okay, well, what's stage three? And then many are talking about what's stage 4 and 5, and what's that going to mean for us? So, I think, stage two is probably manageable. Stage one was fine, although some are suffering a little bit, but that's not an issue. But they're like, how do we do this going forward? It gets pretty complex. So there's the concern more than the existing stuff.
And are you, or did you have an opportunity in this setting to look at the differences between what large systems are doing and what maybe rural hospitals are doing in terms of their resources for meaningful use?
I don't think I've seen too much. I'm trying to think back of everyone I talked to. There was some, obviously there's just a scale issue, right? So, yeah, I think that also the financial impact is felt a little more by the rural than the larger ones. But yeah, I mean, I don't know if I saw anything much beyond that.
For ICD-10, did the people you talked to seem ready to deal with it, if anyone can be?
Actually, I think ICD-10 may be one of the biggest topics I've heard discussed here, and there's real concern about what those impacts are. In fact, I think I'm going to create a whole weekly series of ICD-10 blog posts covering the challenges. I think they're really concerned, and I don't know if they're ready. Although, interestingly enough, there was an observation, which I think is apt, that the members of CHIME were actually far ahead of where I think the industry is. I don't know what that says about CHIME and the people who come to CHIME, but I think they're ahead of it. That as far as training and understanding of what needs to be done, and they've really taken a proactive approach to it. So maybe CHIME members are more proactive than regular ones. But but there's certainly a fear about when that day hits, right? When D-Day hits, was October 15th next year. When that hits, what's the impact going to be? And many of them say, if that cash really starts to or stops flowing because of ICD-10, and there's a dozen reasons why it could, then they're going to have their executives' attention, and there's going to be issues. So they're looking at how do they mitigate that risk and make sure that they get the money.
I have read that both for meaningful use in ICD-10 that there's a particular emphasis on using consultants. Are they feeling that they can handle this, to your knowledge, with their existing staff, or is there a lot of consultant contracting going on to resolve these problems?
Yeah, there's absolutely a lot of consultants, multiple companies, every vendor they work with, and it's kind of all hands on deck from what I've seen. So yeah, I mean, I think they're using every resource. The other one that's really interesting is there's a whole set of learning resources around ICD-10 that they're looking at and using, and there's a real debate about how much time should a doctor spend learning ICD-10. I heard one doctor said that 15 minutes to a half hour was the max that they would do. Another vendor said we were expecting 15 hours per doctor, and so they said to the vendor that said, yeah, you can do it in 2 to 3. They're like, can you really do that? So obviously it's across the board, and that usually means it's not going to play out well.
No, that is not a good sign, right? Definitely
No,
not.
yeah.
But those that don't train inevitably end up with problems, and particularly in this case with the government, right?
Yeah, and interestingly, when it comes to the coders, they were fine spending as much time as needed to train them, I think, generally. But luckily, coders are a much more inexpensive resource as compared with, a doctor. One hospital CIO said, we're expecting $150 an hour for every hour the doctor spends training. So that starts to add up pretty quickly.
Very quickly. Another hot topic, did the conference attendees talk much about their state of readiness for health information exchanges, whether they're engaged or they're having to prioritize, say, meaningful use in ICD-10? How did that fit in the discussions, if at all?
Yeah, I haven't seen all that much discussion of HIE. There's actually a couple sessions today that I was going to catch, so maybe that will add some some layers to it. But I think that most hospital CIOs are watching it. They're involved in those discussions, but they're not really hopping on board because there's still the kind of, I would almost say, perverse incentive for them to participate. So in many cases they don't want to participate because it's not necessarily good for their business, but they're watching it and they're keeping an eye on it and saying, how do we have to be involved? But yeah, I'm not seeing them say, man, this is going to be so great for us.
So it's more honored in the discussion than in the breach, or whatever that quote was.
Yeah.
So the statistics I've seen that suggest that hospital executives are interested are just that, you'd say. They're just interested as opposed to willing to put their money on the line.
Yeah, I mean, I think there's exceptions, but I think a large portion of them are just watching what's happening. They're participating in the discussions, but they're not pushing anything forward, except for when they have a large hospital system and they're creating a private HIE. I think many of them are digging in deep there across their own organization. But outside of that, they're just kind of sitting, watching, and if something develops, they want to have their hand in it and guide it and influence it, but they're definitely not making it happen.
Oh, okay. Now here's a wide open question, John.
Sure.
Based on what you heard at the show, what problem, if you can isolate one, you think worried the attendees the most?
I think maybe it's a tie between the ICD-10, which I already mentioned. I think they're really concerned about that, even though it's a year out. Although many of them say a year, that's nothing. But there's also the other problem with ICD-10 is there's a lot of things that are out of their control. For example, if they send in the claims with ICD-10 and their payers don't pay them based on that, then that's not really in their control. Sure, they can send another request. They can also send follow-up. But what happens if that request gets ignored? I had one person, one hospital CIO, talk about 5010, where they didn't get any money from their plan, from their payer, for a whole month. And that's a real issue for cash flow when you're not getting paid for a month. And they'd audited everything. They were sending everything according to 5010, and the plan wasn't ready. So I mean, there's a number of things that are out of their control. Say an EHR vendor that they followed up with and said, "Are you going to be ready for ICD-10?" They say yes. So yes. They follow up again. Yes, we'll be ready. And then the date hits and they're not ready. Well, that's kind of out of their control. I mean, so I think there's concern there. But the other one obviously is just the changing reimbursement. I think they're all trying to figure that out. I don't know if anyone has any good answers for that.
Does any of the people did any of the people you spoke to talk about the effect of the Affordable Care Act and the infrastructure there affecting their ability to operate?
So I mean, certainly there was some discussion about the Affordable Care Act, plenty of side jokes about the government shutdown and things like that. But I didn't hear any specific things where they said, "Oh, our hospital revenue is going to be impacted so much by ACA." I didn't really hear either way. I think the larger one is the move to value-based payment systems as opposed to the fee-for-service things like reducing hospital readmissions and all of those things. I mean, Farzad said yesterday in his keynote, he said it is 100% the intent of CMS to make it good business for you to be accountable for your care, something like that. So that message is obviously ringing in their ears, and they're saying, okay, what does that mean for us?
That is scary, yes. Was there any? I talked a lot about problems with you, John. Was there any particularly good news or things that people were talking about they feel they are on top of?
Good news at CHIME. It's interesting. Yeah, I mean, I think there's a fair amount of optimism about what's possible, right? I think certainly many of them are dealing with the daily challenges of operational, issues, and so. But when you get out and you say, what's possible, I think people can see that there's a lot of possibility ahead, and that, as one person said to me, they said, we've done the hard stuff. Now that what's left is the fun stuff, really impacting care. And so, hopefully many of them see that way. Although I'm sure some of them that are dealing with meaningful use stage 2 and ICD-10 and ACOs might feel otherwise on a day-to-day basis.
That makes sense. Well, you've sort of covered this, but I'll give you a chance to kind of wrap it up. What are some of your most important takeaways from the show yourself?
Mm-hmm. Well, I think it's an extraordinary time for healthcare IT where they're dealing with huge amounts of government regulation, and then they still have to be innovative enough. Otherwise, will someone come in, this whole changing of how we're seen in healthcare, will that come in and disrupt them? And so, I think that's an interesting challenge, and I think they have those challenges. But it's also an extraordinary opportunity to really use all of this new technology to benefit their patients. So, most of them love what they're doing. They love healthcare, and they really want to help patients. And that's one of the beauties of working as a hospital CIO is you can really impact people's lives. And I think that's one of the beauties, and I think they haven't lost that. Even though, yeah, they need to have the money come in, they can't, like that. That's an important facet. They still understand that, at the end of the day, they're really doing amazing things to help people's lives.
And so you feel like some of the pessimism over these, or the agita over the other stuff, will pass, and they fundamentally want to make a difference.
No, absolutely. I think their hearts are in the right place as far as what they want to accomplish. Certainly, it's a challenging time, but I think they're up to the task. I think there's a lot of really quality individuals working on these solutions from all sorts of angles.
Well, John, thank you for all of the information that you shared about CHIME. It's been terrific talking with you.
Great. Well, it's always interesting to be on the other end, but thanks. It was fun doing it from CHIME. We'll do it again.
Great.